Now, this all comes as Plan B has been enacted. Joining us is businessman and former Dragon's Den dragon Richard Farleigh. Richard, thanks for joining us. We're also joined by Professor Devi Sridhar, Chair of Global Public Health at Edinburgh University, and Senior Clinical Lecturer at the University of Exeter Medical School, Dr Bharat Pankania. Let me come first to you, Richard Farleigh, actually. I mean, in terms of businesses, in particularly those businesses that are in cities, are in towns where people would normally be going to work, is this a devastating moment for them?
Yeah, I think there's only one word for it. Unfortunately, it's terrible, just simply terrible. I mean, the estimates are that it's going to cost the economy, about $1 billion a week. Whether this is the only hope is that this is a lesser of two evils, that by doing some sort of lockdown now, that we don't have to do it later. The one positive for some businesses, maybe not for retail, obviously, but for some businesses is that Christmas is a quiet period. So if you've got to do it for 3 weeks in a year, I'd probably say this, do it now. But the other effect on business is just the confidence level. So the way that's been done by the government, it just feels a bit jerky. And also maybe that sport is prioritised above above business, because you can still have large sporting events, but you stay home. The timing with the government's, obviously with the Christmas party fiasco, is not great. And also there's alternatives for business. You could rotate workforces so that not many people in the office. Businesses learn a lot about spacing and testing. And maybe it's even time to say, compulsory vaccination, or at least a vaccination passport to go to work. I mean, there's lots of other alternatives. So I feel like business has been left at the bottom of this, and it's terrible for everyone, but it is really terrible for business.
Let's just go through the measures in Plan B, and I think we have an image of them for people to have a look at while we talk to you. So home working is being advised from Monday for those who can, and then from Friday, masks indoors, and then the COVID pass for larger venues from next week, and daily testing so that if you come into contact with someone who tests positive, you will not have to self-isolate, but you take a lateral flow test every day. Richard, I just wonder, with this working from home requirement, who decides that? Is it down to the boss to say, right, now we've decided you lot can work from home, but you need to come into the office? Or does the employee decide it? Is that clear?
Well, that's a great question, because no one knows. So if there's a disagreement, who decides? And there's no answer. So hopefully people work it out sensibly, but obviously you'll get cases of conflict and unhappiness about it. It hasn't been spelt out. OK,
Dr Bharat Pankania. One of the contradictions is that, of course, people are being told to work from home, but they can still go to their work Christmas party. Is that something that you think doesn't make any sense?
Of course, it makes no sense whatsoever, as do many of those control measures that we've heard of. So on the one hand, there is this thing of you can go to the park, but on the other hand, you got to work from home. It makes no sense whatsoever. And to be honest, with the Delta variant in widespread circulation, we should have been wearing masks, good quality masks, better specification masks ages ago. To suddenly introduce masks at the last hour is again trying to play catch up rather than being ahead of the curve, keep the infections down by having multiple infection control measures that we should have been doing a little while ago.